Welcome to World AIDS Day 2021, our CART celebration and commemoration. We've gotten here after a long journey. We've dealt with not only the HIV pandemic, but we have another pandemic on its heels with COVID. And I think it added a lot of challenges to all of us over the last year, but I think as a group, as a community, as a family, we've pulled through. And we're going to take a focus this year on HIV in Long Island. And I think it's an important time to look back and see how our region has been impacted by this pandemic and how we've responded to it and how we're going forward and how I think we're in a good position to finally end the epidemic. So it's a hopeful time. It's also a time to think back at where we've been and people we've lost and people who've survived. And I'm so happy that World AIDS Day comes around every year and gives us the opportunity to pause and just reflect and plan and think about where we are. So we have a great program, so please stay tuned. Lots of people are presenting their opinions. There's entertainment, there's commemoration, so a lot of excitement to come. So thank you and welcome.
From the CART family, happy World AIDS Day.
World AIDS Day.
From the front desk team.
HIV on Long Island. Long Island has been impacted by HIV from the very start of the epidemic. In fact, the virus itself was first isolated from the blood of a patient from CART. Dr. Mark Kaplan, my predecessor, worked with Dr. Robert Gallo, the co-discoverer of HIV, to assist in that breakthrough. Long Island has the most people living with HIV outside of New York City within the state. However, the distribution of people with HIV is not even. Due to the development of Long Island, initially as a farming region, and more lately, in the later part of the last century, as a suburb of New York City, there is great economic variability and racial and ethnic segregation, an unequal distribution of wealth among the communities in both Nassau and Suffolk. For example, Nassau has identified 9 communities in which these social and economic inequalities are most profound compared to the rest of the county. So Elmont, Freeport, Glen Cove, Hempstead, Inwood, Long Beach, Roosevelt, Uniondale, and Westbury. These communities have less access to high-quality education and health care, and therefore have the highest rates of HIV in Nassau County, with a disproportionate impact on communities of color and younger men and women. The proximity of Long Island to New York City raises unique challenges to address the evolving epidemic in the region. Many people have moved to Long Island from New York City due to the cost of housing, especially young people who return to live with their parents for financial or health reasons, including a diagnosis of HIV. Low income can be especially challenging due to the high cost of living in Long Island and New York City. The cost of living in this region of New York metropolitan, New Jersey area is 46% higher than the national average. In addition, there's been a large exodus of people from New York City to Long Island as a result of the COVID pandemic, which is shifting the dynamics of social networking and HIV acquisition risk and may destabilize previously established HIV and PrEP medical relationships and stress the resources for providing HIV services in our region. So these are the reasons for the unequal burden of HIV on certain communities and why HIV has been challenging to eradicate. They are also the same reasons that COVID-19 has hit the same communities so hard. On the other hand, we have learned a few lessons, and we know that our way out is to meet people where they are, provide care in new ways, learn about why some people don't seek out care or find it challenging to accept treatment, find out how people assess their own health and provide education and motivation that addresses those values. Try to learn about the reasons for medical mistrust and how to overcome it. This is our new challenge to end both of the current pandemics and the ones to come. What CART represents is a model that is ever growing and adapting to see people where they are and try to meet their needs. Everyone here is a valuable part of that process, including our patients, who will teach us how to deliver care in the most effective and compassionate way. In doing so, we all, the entire Long Island community, could finally fix the imbalances and inequities and ensure that we not only end AIDS, but COVID-19 and prevent COVID-20, 21, 22, etc. That AIDS persists in 2021 despite the great advances in treatment and prevention is a symptom of the imbalance of our society. If we have the will, we need to mobilize economic and educational resources to ensure that no one is left behind and finally cut at the root causes of AIDS. And at the same time, we will right the imbalances that divide us.
Give our hearts to our patients at heart. Happy World AIDS Day.
In June of 2014, New York State detailed a plan to move us closer to the end of HIV/AIDS epidemic called Ending the Epidemic. There are 3 goals: reduce the number of new HIV infections, including encouraging regular HIV testing;
retain people living with diagnosed HIV in medical care to maximize viral suppression so they remain healthy and prevent transmission of HIV. Remember, you equals you.
And offer better education and access to PrEP. Only 54% of people living with HIV are retained in continuous medical care in the Nassau-Suffolk County wide region. Let's link to care and help end the epidemic.
My name is William Depper. I'm 62 years old and I'm living with HIV and AIDS. I was diagnosed at first with GRID in 1982, then in 1984 on an inpatient stay at Glen Cove Community Hospital. I tested positive for HIV/AIDS. In the beginning, there was nothing but AZT that we were taking, and it wasn't until, I believe, 1995 that the good ARVs came out, the antiretrovirals. And that was, amazing because we could get to undetectable. When they were recommending a new medication coming out, it was just introduced to me and I more or less took it. I'm talking about everything from A to Z. A being AZT to Z, Zyogen. I really didn't have too much stigma around it. I was always open about being gay and having AIDS. So, the only stigma I would get were from people who were really uneducated. Mm-hmm. And they would think some people wouldn't come in an elevator with me. They wouldn't even talk to me, thinking, I guess, the AIDS would rub off on them. Matter of fact, at the assisted living facility I lived at, the administrator there, actually he's the owner too, he walked up to me and asked me why do I care so much about this HIV, and when I told him I was living with it, he backed up 10 feet. Without hesitation, just took 10 feet back.
Wow. And
I just couldn't believe it. I'm not at that facility anymore, thank God, but I never talked to the man after that. Yeah, U=U is a campaign that was started, I don't know, I'd say about 10 years ago, maybe 12. It means undetectable equals untransmittable, meaning that if I went with a partner, I couldn't transmit without a condom my HIV to them. But you can still spread other STIs, so it's always recommended to wear a condom, especially if you don't know the person.
HIV, as an HIV positive person, what would you tell other people about HIV?
That I'm just like them. The only thing is I have to take medications every day. But just having HIV, I'm just like you or you. Next year, 2022, will mark my 40th year with first receiving the GRID diagnosis, which is gay-related immunodeficiency disease.
What?
Dr. McGowan, Dr. Kaplan, Dr. Farber, Dr. Shep, and Dr. Epstein, and I think I missed Dr. Hirsch, but those were the best doctors. I started here in 1992. All of them were here, and Dr. Hirsch work. I think that's it. I think I got them all.
Education and outreach team, know your HIV status. Say yes to the test. Conoce tu estatus de VIH haciéndote la prueba. Happy World AIDS Day.
The next performance is very special to us. The song holds a lot of meaning around the unrelenting endurance we frontline workers must display, while also serving as a message of hope to all those we care for.
My name is Juanita, and I am an outreach specialist, and I live in Suffolk County and work here at North Shore. And before North Shore, I worked at Options, and that's where I think I really started my career of outreach. So when I say outreach, I actually go out and find patients that are a loss of care, and my goal is to bring them back into care.
Stigma. How does stigma play a part in the barriers for individuals to remain in care?
Many different ways. You know, you have self-stigma, which a lot of people don't even talk about that, how you stigmatize yourself. You don't even feel equal to another person, that you don't know their state. You don't even know if they're positive or not, but you just feel less than, okay? And it's not a socially acceptable disease. It's not like you can really walk around and like be happy and say, hi, my name is Juanita, I'm HIV positive. You know, you get the looks and you get the lingo of she got the monster. You know, I mean, it still exists. It existed back in the day, and it exists today. So, you know, it's a lot of that goes on. That keeps people out of care a lot of times. They think they're going to be judged. That's the most rewarding part of my position, is the success stories. And I, you know, my back is never too big for a pat, okay? So I'm going to pat my back because I have a lot of success stories. I don't know what it is, but I can talk to a person and encourage them to come into care. And a lot of times I don't disclose my status, which I am HIV positive, because it's not really about me. It's about the patient. But if they say to me, you just don't understand, I go, yes, I do. I have more in common with you than you know. And when they ask me what it is, I disclose to them. And for some strange reason, once I tell them a little bit about me, we're making an appointment on the telephone. And I'm meeting them at that appointment, right at the clinic, and that sometimes can bring tears to my eyes, depending on the situation. The person had a really rough journey to get here, so that's a lot for me. That's a lot, and I love it.
As a person who's been positive for some time, what would you say to a newly diagnosed person?
Depending on how they're feeling, well, I always ask, how do they feel? And depending on how they feel, I can identify with them, and I let them know that I can identify with them, that they are not alone, and that they will receive the best care. Of course, I want the care to be here, because, you know, it's not only the fact that I love the people here, I know the people here, and I know their concern about the care. I know that they will encourage them to continue care, and that is what they need. And to try to remove the feelings of being stigmatized and let them know that it won't happen here. Okay? We will protect you here. You know, it's a safe haven. It's a safe space. And I make sure they know that. I don't know the right words to use, but for me, I am in recovery. I've been in recovery for 19 years, and it took one day at a time, but I had to go through what I had to go through to get to where I am today. And I was stigmatized when I was diagnosed HIV, and I told people. So I understand what our patients feel. When they explain things to me, I got put out. I did this, I did that. I started living to use and using to live. And in order to sleep at night, they had to pay. They had to get paid to find a room to sleep. And they knew they were HIV positive, but they felt that they weren't loved anymore, that they weren't accepted anymore. So I feel that. I didn't go through everything that patient went through, but some of the things that they went through or go through, I can identify with. So I think my identification has a lot to do with me bringing people into care. When they share with me what they go through, I can say, I have more in common with you than not.
Happy World AIDS Day 2021 from the social work team. We're here for you and we hear you. Hi, my name is Amelia Vega. I'm from Honduras and I'm a transgender woman. I started working with people living with HIV in 1998 when I was 14 years old. I'm studying on a new career as a nursing in schools, and I find out the people living with HIV was stigmatized. I moved to United States in 2009, and I started my transitioning. So in my first job, I'm applying for a first job in the fields on 2010. And during this time, I've been engaged with the community, supporting my community, educating my community, creating a new group for a transgender community to get access to medical care, and also working with the transgender living with HIV and connecting and linking our community to access to medical care. One of the most common questions is if I can have a regular lifestyle, so I'm gonna die soon. So my part is educate this person to engage back to the normal lifestyle, and I show them that HIV is only a chronic illness and they can live for many years if they keep healthy and taking the medication, so they can do whatever they want without limitations. The transgender woman, they need special care because when we're trying to access to medical care, we only have specific services, but we need more services like transitioning hormone therapy. We also need a surgery for confirming our physically and or gender reassignment surgery. So I feel the transgender community living with HIV, they need more services than others community, because this help to improve their lifestyles. I want to the whole world know about HIV is a chronic illness and treatable, and people can prevent with different ways as a PrEP or using a condom. So the HIV is not gonna transmit it for giving a hug, for kissing, or for sharing any utensils like sharing the toilet or sharing sleep together. So people, they have to get more education about the HIV prevention and know this HIV is medical disease like others, and this is not the end of the world.
Happy World AIDS Day from the Cart family.
Hi, we're from Oceanside High School.
Happy World AIDS Day!
What is PrEP? PrEP stands for pre-exposure prophylaxis.
PrEP is a method of HIV prevention with once daily oral medication.
PrEP is prescribed to HIV-negative adults and adolescents who are at risk for getting HIV.
PrEP is used in combination with safe sex practices. According to data from New York's Ending the Epidemic Initiative, the number of individuals in the Nassau, Suffolk County, Ryan-White region with a PrEP prescription increased from 80 in June 2014 to 2,230 in June 2020.
We're also celebrating 5 years of the U equals U campaign. Undetectable equals untransmittable.
What is U equals U? People living with HIV who take medication as prescribed can reduce the amount of virus in the blood so it is too low to measure, referred as undetectable.
People living with HIV who remain undetectable have effectively no risk of transmitting HIV through sex.
U equals U is supported by an overwhelming amount of medical research.
64% of the 6,560 people living with HIV in the Suffolk, Nassau County, Ryan-White region were undetectable as of 2019.
My name is Allison Covino. I'm a director of the Access to Care program and services at Options for Community Living. Options, I started with Options, or it started for Options, I guess, working with people living with HIV and AIDS in 1994, July 1st, 1994. I think all the efforts are tremendous. I think we're well on our way toward, ending the epidemic and really getting to some of the populations that are possibly more hidden, in that some of the prevention efforts now are blanketing the region as opposed to zeroing in on particular people. I remember an old coworker and friend of mine who's doing HIV education in the field still, would talk about how when she went to see her doctor, they weren't asking her if she wanted an HIV test. So I think, rather than sort of directing those questions and those interventions at particular populations or particular groups of people that might appear to be at higher risk, we're blanketing them in the region now and getting to some of those undercurrents of populations at risk that maybe weren't bubbling up to the surface before. So I think that's a stronger way to reduce the amount of people at risk and, hopefully getting HIV. I would say that people are a lot more comfortable in their own skin, maybe more comfortable, more confident. We have many peers that are living with HIV working for us now, and they've just offered and provided a tremendous amount of wisdom to the program. We haven't had them all along. We always had clients. We didn't always have clients that are working for us. So I think the confidence and in the beginning, maybe they were asking more about, what's going to happen to me, versus now it's like they're working for us and they're alongside us and not as worried about the future, not as worried about dying as they were. People are just sort of able to get back to their old lifestyles, perhaps, or their old, ability to function over time for a lot longer than they ever would have anticipated back in the 80s or early 90s. I think people were a lot more worried about dying back then. So that was probably one of the most common questions is, am I going to be okay? Am I going to die? What's going to happen to my kids? Versus now, it's not really something that people talk about very much at all. I'm really, really proud of the programs that we run because they provide people with a lot of support. And it's one of the best things that I think Options has ever accomplished, the kind of work that we do, the kind of work we continue to offer, and how much integrity has been put into the community, put in through the programs and supporting people with HIV.
Happy World AIDS Day from the finance team.
My name is Cynthia Young. I'm a nurse here with working with HIV and AIDS. I have been a nurse for 30 years, and I got into it because back in 1989 I was doing clinicals, and I was doing it at Winthrop Hospital, and there was a tray on the floor, and I went and went to bring it into the patient, and I was yelled at that, no, you can't do that. That patient has AIDS. And I thought, gee, I couldn't even treat my dog like that. How could I treat a human like that? So from that day on, I was so appalled that from that day on, I decided that was my goal. I was going to be an HIV nurse. So I went to work in a hospital in the beginning in 1991, and many, many sad cases. Some very good cases, but most of them very sad.
What's your thoughts around stigma and HIV?
I guess to some extent, I think there is more knowledge out there. I think the younger generation is very knowledgeable about it. I think the older generation still has such fear about it and still backs up. If I even say I work with HIV patients, they back up away from me like I can transmit it to them. So I think in time there'll be less and less stigma, but it is still out there, and it's a lack of education. I believe people still are in the old way of how it's transmitted, and they don't understand it. They also think of HIV people as drug addicts or just bad people, and it's not that way, and you try to explain it, but people get these ideas in their head, and it's very, very hard to change them.
So you mentioned older generations. So what would you say to older generations to kind of clear up some of the misconceptions about HIV?
Like try and give them the knowledge that it could happen to anyone. I give them examples of women who had unsuspecting husbands, people who had blood transfusions, people we have hemophiliacs who got it from factor VIII. I mean, there's many, many reasons, and it's only transmitted 2 different ways. And really, if the person is viral load is undetectable, it's not transmitted at all through blood or bodily fluids. So it is remarkable what we have learned about HIV compared to the old days.
Happy World AIDS Day. Love the pharmacy team.
Well, my name is Natalie Singleton. I am an RN. I have been working here at ID Cart since, well, actually it has been since 2017, but I used to work here before, back in when the towers got hit. And I was actually the supervisor of the clinic back at that time. So when I came back as a different role as an RN care manager.
What would you tell someone who has just received an HIV diagnosis? What would your advice to them be?
Okay. Well, since we get that every day here, okay, it's hard for me, and I talk about this all the time because coming from the beginning, and when I see a new person diagnosed today, that hurts because we've come too far for us to be going full circle again. Everybody plays a role in educating. So when I'm in the room with some of the people that regardless of their age, I tell them, number 1, this is not a death sentence. I tell them, number 2, I said, your life is what you make it. So if you're going to stay depressed, if you're going to stay in a slump, then your health will stay in a slump. So I tell them the type of clinic that we have here and the services that we provide, I encourage them to use us to the fullest. And they do. They do. And I try to show them that I am a support for them. And I tell them, your viral load may be this right now, but once you start taking the medicine, you become undetectable. And I said, you'll live a nice life. I said, nobody says that you cannot have a child. I said, I have plenty of couples, married couples, and they have children, and their children are all negative. I said, so this is not the end of the road for you. Don't ever believe that it's a death sentence for you, because it's not. I have people who are 80-something years old that's diagnosed. So I just try to be as positive as I can be and make sure that they know that we are here for them this entire clinic with all the services that we provide between psych, the social work, the mental health services. We have, what else we have? We have health ed, we have RAP, we have the nurses. There's no other place that you really truly get what you get here. And
Happy World AIDS Day from the Data Team!
My name is Jamie Peeler. I'm a health educator here for the Center for AIDS Research and Treatment. Inside the clinic, I see patients who are living with HIV. I talk to them about treatment adherence, help them with getting to their appointments, and help them with any barriers to their treatment. I also supervise the outreach team. We have a mobile team that goes out into the community. We drive out, we park on streets, and we get people tested for HIV, hepatitis C, and for syphilis, and connect them with care if they need that.
I think that is.
There's many challenges. I mean, first off, you have Long Island. There's not that many places that people know of where they can go and get care for HIV or even preventative services. And then you have the whole public transportation system out here, which is not as reliable as maybe in the boroughs or the city, where you have buses that don't run that often. Maybe the buses don't go to all the places that clients or patients would need to go to. There's a lot of issues. You have people here who live in communities where they don't even have healthcare services at all. They don't have free clinics. They don't have doctor's offices. So for someone who lives on the South Shore of Long Island, they have to travel all the way to the North Shore just to get those services, which can be difficult for people. When you look at areas like Hempstead, Roosevelt, Westbury, Freeport, those are areas where there's high populations, communities of color. Because of the stigma that's in those communities, people don't want to talk about HIV. They don't want to talk about getting tested. People are still associating HIV with being a gay man's disease. So because you have a lot of young men, especially MSM on Long Island and Nassau County, who are not out to their families or maybe not be that secure with themselves for the sexual activity that they have, these people are not going to be that open to even having discussions.
My name's Scott Peterson, and I'm the operations supervisor for the HIV Service Line program here at Northwell Health. And I just want to thank everyone for watching our tribute to World AIDS Day. We know the HIV epidemic still exists, and as you've just heard, there have been so many amazing things that have improved treatment for people living with HIV and prevention for those who aren't. We still have to cross the finish line to end this epidemic. So I'm going to ask you all for 3 things. 1, know your status. Sexual health is a part of your overall health. Knowing your status can only help in living a healthy life. 2, learn more about HIV. Educate yourself. The only way to stop the stigma of HIV is to learn about it. And 3, have conversations about HIV with people in your life. It doesn't have to be an uncomfortable conversation. By making these types of conversations a regular part of life, we defeat the stigma that has surrounded the virus since the 1980s. Again, I just want to thank everyone so much for watching. And I want to thank you all for doing your part in ending the HIV epidemic.
If you are HIV positive and in need of care, or HIV negative and interested in PrEP, please call the Center for AIDS Research and Treatment at 516-562-4280.